Hi, my name is Manisha Kumari, and this is my physical head-to-toe assessment final practical exam video. So I'm going to start off by doing hand hygiene. Now I'm going to wipe my stethoscope with this wipe. Now I'm going to don my gloves. Okay, and I'm going to start. So, hi, my name is Manisha Kumari. I'm going to be your student nurse for today. I'm going to be conducting a physical head-to-toe assessment today. Is that okay? Okay, I have patient consent. I'm going to provide patient client privacy by closing the curtains. Okay, to start off, I need to see your ID bracelet. Can you please state your first and last name?
Kumar.
Date of birth?
October 2005.
Great, so it matches. Now we can start. So in terms of your physical appearance, he matches his stated age. I do not smell any foul odor, and his height is about 6 feet in terms of body structure, and his body is symmetrical as well, and there are no physical deformities. Now moving on to behavior, you're able to maintain good eye contact with me, you're dressed appropriately according to the weather and the environment, and I have no hygiene problems, I don't see any hygiene problems, and you're able to express your emotions through facial expressions as well. Now, in terms of his work or breathing, I do not see any signs of distress or any labored breathing as well. I'm going to assess your gait, so can I get you to get up and just walk there and back? Great, his gait is normal as well. There's no altered range of motion. Now I'm going to assess his level of consciousness. Please say your first and last name.
Kumar.
Where you are today.
In a clinic.
And what's today's date?
April 10, 2022.
Great, so he's alert and oriented to time, place, and person. And his speech is also appropriate in terms of volume and rate. Now I'm going to move on to start with your head. So his head and skull size normal cephalic. Do you feel any tenderness anywhere?
No.
No, I do not feel any lumps, bumps, lesions, or bruises, or see any edema, or feel any masses or nodule as well. Now, in terms of his hair color, it's black. There is no infestation in his hair, and it's evenly distributed. Now, I'm going to move on to your face. Can I face your face? Okay, his face is symmetrical. There's no involuntary movements. I do not see any lumps, bumps, lesions, or bruises as well. And now I'm going to palpate. Do you feel any tenderness anywhere?
No.
Okay, so he does not feel any tenderness anywhere. Well, that's good. Now I'm going to check your cranial nerve number 7 with facial nerve. Can you please smile for me? Now frown for me. Now raise your eyebrows. Now puff out your cheeks. Now close your eyes, and I'm trying to open them. Keep them closed with resistance. Great, so he's able to do the following exercises, which means his cranial nerve number 7, which is facial nerve, is intact. Now I'm going to move on to your eyes. So in terms of his eyebrows, they're symmetrical. His eyelashes are evenly distributed. Eyelids are bilaterally symmetrical as well. Please look up. His conjunctiva is pink as well, and now his sclera is also white. Now, can you open and close your eyes slowly for me? Okay, there's no ptosis, no lid lag, no crustiness in his eyes, no discharge, and I do not see any exophthalmos as well. Great, now I'm going to assess your cranial nerve number 3, which is your oculomotor nerve. So for that, I'm going to grab my pen light. Okay, so first I'm going to check your pupil size. Can you just look straight at me? Okay, so his pupil size is 3 millimeters, both pupils, which is perfectly normal, and both pupils are also round and symmetrical as well. So now I'm going to assess your direct consensual right reflex. So please look straight ahead at me. Okay, both pupils constrict, which is perfectly normal. Now I'm going to test your accommodation. Keep looking at this object at the top of it. Okay, so the pupils dilate when the object is further away from his face, and they converge and constrict when the object is near his face, which is a normal finding. Now I'm going to move on, pen light back, and I'm going to move on to his ears. So in terms of your ears, they are symmetrical, normal shape, color is consistent with acne background, there is no discharge. Now I'm going to palpate his ears, so if you feel any tenderness at the auricle or the tragus, no tenderness. Great. Now I'm going to do the whisper test. So I need you to repeat the following words I say to you, okay?
Monday, closet, apple.
Great. Now I'm going to do the other ear.
Monday, closet, apple.
Great, so you have no hearing loss and you passed the whisper test, which is good. Now I'm going to move on to your nose. So his nose is midline, there's no nasal flaring, no discharge. I'm going to palpate your sinuses, so please tell me if you're feeling tenderness. So maxillary sinuses, no tenderness? Okay, and his frontal sinuses. Any tenderness?
No.
Okay, but you felt mouth pressure, right?
Yes.
Okay, perfectly normal. Now I'm going to move on to your mouth and pharynx. So I'm going to grab my tongue depressor and pen light. Okay, so please open your mouth. First, I'm going to start off with an inspection of his lips. There's no swelling, and the color of his lips is pink as well. Now, can you open your mouth? Okay, and we can see that his tongue is hydrated. It has a pink color, and there are no lesions as well. His hard and soft palate are also hydrated, pink in color, no lesions as well. A hard and soft palate have no lesions, and they are pink in color. We can see that his teeth have no looseness or caries as well, and we can also see that the bottom of the tongue is also hydrated and pink. And the gums, we can see that they have no bleeding or not swelling, and the gums are pink in color as well, which is perfectly normal. Now I'm going to assess your cranial nerve number 9, which is your glossopharyngeal nerve, and vagus nerve, which is cranial nerve number 10. So I need you to say ah for me. Okay. And I can see that the soft palate and the uvula rise up and down midnight, which is perfectly normal. So cranial nerve number 9 and 10 are intact. Now I'm going to assess your cranial nerve number 12, which is the hypoglossal nerve. So for that, I just need you to stick out your tongue. Okay, like this. And we can see the tongue is midline, no tremors. Say tight like dynamite.
Tight like dynamite.
And now move it against each cheek like this. Okay, so he's able to do all 3 exercises. So his cranial nerve number 12, hypoglossal nerve is intact. And I'm just going to do hand hygiene once more. Okay, so now moving on, I'm going to be inspecting your neck. So first of all, keep it straight ahead. Okay, to start off with his neck, I do not see any obvious thyroid enlargement. Neck is symmetrical, color is consistent with ethnic background. There are no lumps, bumps, lesions, or bruises as well. Do you feel any tenderness anywhere?
No.
Okay, good. And temperature is warm to touch as well, normal body temperature. Now I'm going to palpate your keratoid pulses. Okay, so keratoid pulses have a regular rhythm of 70 beats per minute, a rate of 70 beats per minute. Regular rhythm ends in a grade strength of 2+. Now I'm going to ask you to do the following exercises to assess a cranial nerve number 11, spinal accessory nerve. So please shrug your shoulders against my resistance. Okay, good. Now turn your head this side against my resistance and this side. Great, so he's able to do the following exercises, and which means his cranial nerve number 11, spinal accessory nerve is intact. Now I'm going to move on to your upper extremities to assess the peripheral skin, vascular skin. So in terms of inspection, both arms are symmetrical, no involuntary movements, no deformities, and I do not see any lumps, bumps, lesions, or bruises. I'm going to palpate. Okay, any tenderness anywhere?
No.
Okay, good. I do not feel any edema, no nodules or masses, and in terms of temperatures, normal warm body temperature, and in terms of texture, is smooth and dry as well, which is normal. And I'm going to assess your capillary refill. Please let me see your fingers. Okay, the color returns within 2 seconds of each for each nose, so capillary refill is also normal. Now I'm going to be assessing your radial pulses, palpating your radial pulses. Extend your arms. Okay, so palpate them like this, bilaterally. Okay, so bilaterally, the radial pulses have a regular rate of 70 beats per minute as well, and they're equal bilaterally. Now I'm going to palpate your brachial pulses. Extend your arms. Okay, brachial pulses have a rate of 70 beats per minute, regular rhythm, and they're equal bilaterally as well. Okay, now I'm going to assess your legs. So in terms of inspection, we can see that the legs are symmetrical. There are no involuntary movements, no deformities, and no lumps, bumps, lesions, and bruises. Now I'm going to be palpating the legs. So just like this. This camera. Okay. Any tenderness anywhere?
No.
Okay, and texture is also dry and smooth. I do not feel any masses, nodules, or edema, and normal warm body temperature as well. Now I'm going to assess your capillary refill in both feet. Okay, color returns within 2 seconds, which is a normal capillary refill. And now I'm going to be palpating your dorsum pedalis pulse, just right here. And equal, they both have an amplitude of 2 plus a normal rhythm, and they're equal bilaterally as well. And I'm going to assess your posterior tibialis pulse, which is right here behind. And the posterior tibialis has a regular rhythm, and they're equal bilaterally, and they have a amplitude of 2 plus as well, which is normal. Okay, now I'm going to move on to your posterior thorax. Can you please turn around? Okay, so in terms of the inspection of his posterior thorax, we can see that there are no skeletal deformities. His shape is normal, it is symmetrical, and there are no lumps, bumps, lesions, or bruises. I'm going to palpate. Do you feel any tenderness anywhere? No. Okay, now temperature is warm, normal body temperature, and texture is smooth and dry as well. Now I'm going to assess the symmetrical chest expansion. I'm going to palpate it. So, okay, breathe in for me. And breathe out. Okay, so we can see that his symmetrical chest expansion is also normal as well. Now I'm going to assess your anterior posterior to transverse ratio. So can you please put your elbows up? Okay, so these 2, 1, and 2. Okay, so his ratio is 1 to 2. Which is a normal AP to T ratio. Now I'm going to percuss your posterior thorax for resonance and dullness. Okay, so there was resonance over the lung peripheral lung fields, and there was dullness over the liver areas. Now I'm going to auscultate your lungs. Okay, I'm going to auscultate your lungs, and all I need you to do is just breathe in and out, okay? Breathe in, out, in, out. So at the top of the lungs of the APCs, I heard vesicular sounds, bilaterally equal number of bed sounds, and no adventitious sounds were heard. Now breathe in, out, breathe in, out, 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 in, out. Okay, so I heard bronchivesicular sounds between the scapula. No adventitious sounds were heard, and the bed sounds are equal bilaterally. And over the rest of the lung peripheral lung fields, I heard vesicular sounds equal bilaterally. No adventitious sounds were heard as well, and they were equal bilaterally as well. Equal bed sounds. Can you turn it around, please? Okay, now I'm going to auscultate for bronchial sounds of the trachea and larynx. Okay, breathe in, out, in, out. I heard bronchial sounds of trachea and larynx. No adventitious sounds were heard, and bed sounds are equal bilaterally as well. Now, okay, so now that we're done auscultating, I'm going to assess your respiratory rate. And your respiratory rate is 18, normal quality, and regular rhythm as well. Now I'm going to auscultate your heart. So I'm going to first palpate the landmark, and then I'll auscultate it. So starting off with the aortic valve, so second intercostal space, right sternal border. S2 is heard the best here. Moving on to pulmonic valve, left sternal border for aortic, right sternal border for aortic valve. Then left sternal border for second intercostal space is a pulmonic valve. S2 within limits, then left sternal border, third intercostal space Erb's point. You hear S1 and S2, which are equal. Then tricuspid valve, left sternal border, fourth to fifth intercostal space. You hear S1. And then at the mitral valve, which is a left mid-clavicular line at fifth intercostal space, I hear S1 as well. And I'm going to go over the same valves with my bell to hear for extra heart sounds. So aortic valve, no extra heart sounds. Pulmonic valve, no extra heart sounds. Tricuspid valve, Erb's point, No extra heart sounds. Tricuspid valve. No extra heart sounds. And the mitral valve. No extra heart sounds. Now I'm going to auscultate the apical pulse for 1 whole minute, which is at the 5th intercostal space, left macrovicular line, and the right at 70 beats per minute. Rhythm is regular as well, and quality is normal of the pulse. And now I'm going to assess your abdomen, so I need you to please lay down on the bed. I'm going to drape you. Okay, so to start off with the abdomen, we can see that from the side the contour is flat, and that we don't see any stria, no lumps, bumps, lesions, or bruises. Abdomen is symmetrical, colors consistent with ethnic background. Umbilicus is midline as well, and even hair distribution. Now I'm going to auscultate for bowel sounds in each quadrant. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, so for in each of the quadrants, I heard hyperactive vowel sounds, which are high-pitched gurgling sounds, which is completely normal, and I heard irregular balance sounds 5 to 30 times per minute in each quadrant, which is normal as well. Now I'm going to perform percussion in each of the quadrants to listen for timpani, right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. I heard timpani in each quadrant, which is completely normal. Now I'm going to prefer light palpation in each quadrant. Light lower quadrant, light upper quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. In each of the quadrants, I did not feel any superficial masses or any rigidity. Now, can I please get you to get up, and you're going to perform some musculoskeletal assessment. So for the following, just follow me. Okay, so starting off with fingers, you need to flex your fingers, extend your fingers. For the wrist, you need to flex your wrist, extend your wrist. Now do radial deviation, ulnar deviation. Now for the elbows, you need to flex your elbows like this, extend your elbows, and supinate them like this, and pronate them. Now for your shoulders, please do external rotation, internal rotation, abduction away from body, and towards the body, adduction. Great. Now grip here my hands, my fingers with all your strength. Good. So no muscle weakness, bilateral equal hand strength. Now for your feet, I need you to do dorsiflexion, which is basically dorsiflexion towards your nose. Point your toes towards your nose and apply resistance. Okay, and he is able to do that properly. Now do plantar flexion, apply resistance, and he's able to do that as well. So toes did not have any bilateral weakness. It had good strength bilaterally. No muscle weakness was noted. Did you feel any pain? Okay, so there was no pain, there was no crepitation, there was no altered range of motion observed, and this ends my physical head-to-toe assessment video.